Hey guys, this is Dr. John Cross from Cross Cultural Management, and we'd like to welcome you to one of our first podcasts. This is on workplace hygiene and illness prevention. And this podcast is largely due to OSHAcademy. This is actually their course number 138, and we obviously brought this out because of what's going on, the COVID-19 crisis. Although this doesn't specifically refer to COVID, we have incorporated extra material to help people understand the importance of taking precautions in this era of COVID-19. So this course is going to focus on what employees need to know to stay healthy in the workplace. It is a OSHA course, that is, it follows OSHA procedures and requirements, but we've also incorporated advice and other ideas from other World Health Organizations and things like that. Topics will include workplace hygiene, housekeeping, contagious diseases, and disease prevention. So this course will discuss how to prevent specifically the spread of communicable diseases, including COVID-19. So let me introduce myself. My name is John Cross. This is a podcast, so we don't have any participants, unfortunately, and we don't have to worry about any of the other issues. If you want a certificate for this course or any of our other courses, please visit our website. It is www.crossculturalcenter.com, and we offer courses for NEBOSH, IOSH, IEMA, which is the Institute of Environmental Management Association, or OSHA, and we also offer courses in management, supply chain management, leadership, procurement, communication, many other topics. So my email is there, and look forward to hearing from you if you need any support. Now, for this course, some of the key terms we'll be discussing: disease. What is a disease? Typically, diseases, well, there are two main types. One is transmissible diseases or contagious diseases, diseases you get from somebody else. And these are typically caused by germs or pathogens that infect your body and may result in discomfort or sometimes death. And the host in this case is the body or the organism, human or any other, which the germ or pathogen invades. And communication or contagion, this is the process by which the disease or these germs move from one host to another host. Now, other types of diseases we'll talk about later on are not communicable, and we'll just discuss those in passing. So what is a contagious disease? So these are caused, as I said, by pathogens which can live in your body. They are living organisms, and they survive by using parts of your body and then finding a way to move on to other bodies. If they didn't move on, that is a process of contagion or transmission from one person to another, they would die when you died. And of course, the whole species would be extinct. We wouldn't need to worry about them. They would only kill one person and they'd be gone. But no, the problem is they spread from one person to another, and that's what causes what we see as a disease path or transmission. Right? Two main types of pathogens are bacteria and viruses. We'll discuss those in a second. So bacteria is a single-celled organism. These are very small. You can't see them. They live everywhere. They live by, well, they're complete organisms. So as long as they're in an environment that is conducive to their well-being, usually that means having some nutrition, having a certain amount of temperature, warmth, not too much, not too little, having the right kind of food. And of course they're very small. There are millions of them on your skin, inside your body, on your computer, on your table. So these are everywhere, they're ubiquitous, and they're not all harmful by any means. Many bacteria live in a symbiotic relationship with you. For example, you have gut bacteria, which is what this picture here is all about. This gut bacteria is actually being attacked by a virus. These little things that are sticking onto it and trying to invade it, get inside of it. So not all bacteria are bad by any means. Some are good or necessary, but if they get in the wrong place, that's where they can cause problems. If you have a cut and it gets infected by gangrene or other types of bacteria, you may have to cut off your arm, or you may have to have a very bad infection, or you may die. Now, virus is different. Now, virus is basically just a protein molecule covered with fat, and it doesn't really have a full life. I mean, it doesn't really live like a bacteria does, but it wants to reproduce. So the way the virus reproduces is by getting inside a cell, a one-celled animal, like a bacteria, or inside the cell of a multi-celled organism like you, right? So if they're able to do that, they take over the cell and use that cell to make copies of itself, right? So it's like taking over a factory, and they replicate themselves. They make millions of clones, right? And in that process, of course, well, the cell will die because they use up all its resources. And when the cell dies, there are millions of these bacteria now, and then they go poof, and they explode out into their environment, and they will look for new cells, right? So they have to find constantly new cells to invade, right? So if one gets into your throat, then it'll spread. The virus, the millions of viruses will go look for other cells, and at the same time, they'll try to find a way out of your body and into somebody else's body. So types of diseases like this, like the common cold. Common cold is often caused by viruses that affect the nose and throat. You have the influenza, this is the flu virus, right? Also affects the nose and throat, and in some cases the lungs. The coronavirus, there have been several different versions of this. There's the SARS, the MERS, now we have COVID-19, right? Norovirus, this is a type of virus that affects the stomach. Measles, that's another type of virus. Strep throat, now this is a bacteria that affects the throat, and particularly the lymph nodes. And E. coli bacteria, this can cause diarrhea. So here are some examples of different bacteria. This bacteria on the right here, the top right, is a gut bacteria. It actually helps you with digestion, and this one's being attacked by a virus. So this virus is not attacking you directly, but it's attacking the gut bacteria. And if it does a lot of damage to your gut bacteria, that can then cause you problems because you won't be able to digest your food properly. The COVID-19 virus here on the left looks like it's wearing a crown. That's where the word corona comes from, right? These bright appendages, red appendages, help it attach to the host cell and then get inside of it. Here, these little blue bacteria right above my head, these are E. coli bacteria, and if they get inside your stomach, they then pass out through your stool. And unlike viruses, bacteria can live outside the body for a long time, as long as they have the right environment. In fact, they can reproduce and grow outside the body and can be quite comfortable in many ways. But most bacteria have at least some relationship with other organisms, because just to be in the environment may subject them to many hazards. So it's better for them in a way to be inside a body where they have the nice, your body has nice regular temperature and nice regular food source. So they enjoy that quite a bit. Now, communicable, as I said before, communicable diseases mean diseases that are passed from one person to another, and these are caused by very small germs. It took a long time for people to realize this. In fact, it wasn't until about less than 200 years ago that the medical field accepted the concept of germs and said, there are little itty-bitty things that cause you to be sick. Before that, they thought it was spirits or vapors or something else, right? Now, the reason these germs are different from vapors is in a vapor, if I'm exposed to a vapor or a gas, that will have an immediate effect on me. But once I'm removed from the gas, I can recover. The problem with the germs is once I'm infected by a germ, it will then grow inside of me, or rather reproduce, and the population of germs will grow inside of me. And that's what causes the problems, right? And then at some point, I will then pass it on to somebody else. So I then become contagious. I become somebody who is passing on the contagion. Now, there are lots of other diseases that have nothing to do with contagion. These diseases are caused by environmental factors. It may be that you have genetic issues like Crohn's disease, or there might be environmental factors like radiation causing cancer. There may be behavioral factors like you eat too much fat. Hey, not me. So these things can cause heart disease, cancer, or diabetes. They're not contagious. That means just because I have a bad eating habit, that is not going to cause you to be sick, right? Unless you eat the same food I eat, right? So me having a heart attack is not going to cause you to have a heart attack. It doesn't communicate to other people. Well, communicable diseases, like I said, they need to be transmitted. They need to pass from one person to another. So the cells, the virus or bacteria that attack you, right, and attack your cells, they're going to reproduce. They will then attack more cells until your throat is irritated. And then your body is going to notice this. So the body is getting information back from various sources that you personally in your brain may not be aware of, but your body is aware of it. So the body reacts by doing certain things. It might raise the temperature, what we call a fever, right? That's an attempt to maybe burn off the bacteria or virus, and sometimes it works. It may cough or sneeze, right? And these are reactions to the inflammation of the throat, or clogging of the lungs. So the body's literally trying to clear up the lungs or the throat by coughing and sneezing. And many times you shouldn't try to suppress these things. In a way, they're natural reactions of the body. But here's another thing. For a lot of these diseases, there are also ways that they pass from one person to the other, right? So when you sneeze or cough, everybody around you suddenly is breathing in what you just coughed up, right? That's called airborne transmission. So airborne transmission is when you cough or sneeze, or even just regular talking, stuff is coming out of your mouth, right? That's not a very pleasant thing to think about, but it's true, right? So that's why using a mask may be effective in preventing you from transmitting your disease to other people, and to some extent from catching a disease from other people. Direct transmission, so for example, I cough on my hand, I shake your hand, and then you put your hand to your mouth maybe later in the day, or you eat something, and then the virus or the bacteria gets inside you. And indirect transmission, you touch something, you drop bacteria or virus is there, and then somebody else touches it and picks them up, and then there you go. Vehicle transmission. So vehicle transmission means there's a way in which the germ or the pathogen gets from one person to another. It's a bit more indirect. So for example, it may be the sewage system. If you have a badly designed sewage system, people might have diarrhea. It goes into the sewage, and then maybe it leaks out somewhere or leaks into the water system, and other people then drink that water, and it has bacteria in it, so then they get the diarrhea, right? So cholera epidemics or outbreaks typically are of this nature, right? And then you have vector transmission. Vector transmission is when you have a third agent, like for example, you have a mosquito, and the mosquito bites you, and then it passes on the disease that you had to somebody else, the next person they bite. And this is true for many tropical diseases where there's a lot of mosquitoes, so like or other similar things like the tsetse fly, or mosquitoes that cause sleeping sickness, or other types of things. So this just illustrates some of the more popular methods of transmission of respiratory diseases. So spread through direct contact. You cough on your you cough on your hand. You shake somebody's hand, and then they, for some reason, put their hands in their mouth, which is something people do on a regular basis. We're always touching our face, and so if we don't have clean hands, it's very easy to pass or get sickness through that way. Spread through contaminated surfaces or indirectly, so the contaminated person, again, coughs on their hand and they touch a doorknob or some other surface. Somebody else then also touches it and then carries it to their mouth. And then obviously you have through air droplets, as I expressed before, you're going to cough or sneeze, and then next thing you know, everybody around you is going to be breathing that in. Not very nice. So always cover your mouth when you cough, or cough into your sleeve, or better yet, wear a mask that will hold in the particles. Symptoms. So the symptoms, what we feel is not usually the disease, but our body's reaction to the disease. So we'll feel, if we have a fever, the fever will typically also give us a headache and aches and pains. So that's a symptom of maybe a cold or a flu, right? So it's telling us that our body is reacting to something in an abnormal way, right? Now the symptoms themselves, because the symptoms, you often have the same symptoms for different diseases, so the symptoms themselves don't necessarily tell you anything about which disease you have, but it gives the doctor a clue. And very often they will then, you can make it sure by having a test. Now with COVID-19, you want to be very careful. If you do think you have any flu symptoms or cold symptoms, these could also be COVID-19 symptoms. So if they are, that means you are now contagious. You're spreading that disease. So you want to instantly seal yourself off. We'll talk about this more later. You want to self-isolate, all right? And then you want to get in touch with your medical authorities or your doctor so they can test you to see if you really do have it. If you don't, then you can go back to more or less a normal life. But really, if you have a cold or a flu, you should self-isolate anyway. I mean, you shouldn't be going around the neighborhood spreading the flu and the cold. That isn't very neighborly now. So, for example, the common colds, you got runny nose, sore throat, sneezing, coughing, head and body aches. For the flu, you got, again, many of the same: fever, cough, sore throat, runny and stuffy nose, head and body aches, fatigue, vomiting, and diarrhea, right? The COVID-19, very similar: fever, dry cough, shortness of breath. There are many other symptoms that may also be present. Shortness of breath is very often the most important one, because that means it's very serious. If you're starting to get short of breath, that means your lungs have been compromised. And it doesn't affect you the same way as the flu, but I'm not going to go into that. I am not a medical doctor. I'm a doctor of sociology. Strep throat, sore throat, this is caused by a bacteria, so it attacks your lymph nodes. It means you have inflamed lymph nodes. So it's not the same as a virus that infects the cells or the lining of the throat. E. coli, you might have severe body cramps, diarrhea, vomiting, and fever, and it can't kill you because the diarrhea can dehydrate you. Salmonella, so this is similar, is also something that affects your body, your stomach, diarrhea, vomiting, nausea, stomach pain, fever, head and body aches, and salmonella also can be quite deadly. So severity, so how severe? Severity of a disease you can measure in different ways. Typically it's going to depend on two factors, or three rather. The disease itself, so what does the disease itself do to you? It's possible secondary infections that may occur, and the health of the patient. So the disease itself, for example, the common cold, it's going to get in your throat, but generally we're fairly immune. Our body attacks those viruses pretty quickly, and within a day or two, our immune system reacts and puts us back in business, right? With the flu, what happens is sometimes the flu will get into our lungs and then cause a secondary infection of pneumonia, right? So that's the problem. And of course, health of the patient is very often, because if you're already very sick or maybe old and infirm, then even a very, a mild cold that normally might not hurt you could become deadly, right? Treatment options may also vary. Sometimes there's a cure, right? But you'd be surprised. Most times there isn't a cure. Like when you take a pill to take for an aspirin or Tylenol, these reduce your fever. They don't cure the disease. They reduce your fever so you don't have discomfort, and therefore your body is allowed time, to recover itself, to fight the disease. So most of the time, your body is its own cure. All the pills you're taking are only to manage the symptoms, right? And some people might argue that it's counterproductive. For example, if you lower your fever and the body is making the fever in order to kill the virus or the bacteria, then aren't you defeating the whole purpose of the body of the fever, right? So some people might say you should let the fever run its course. But if any fever, if it gets too high, over, I believe 104, but don't take me as an example, then the fever itself can kill you by dehydrating you or causing heat stroke. So again, any decision you make like that, you should take with a doctor, right? For example, common cold, it's caused by viruses. Now, there's typically no vaccine or cure for the common cold, but our bodies are, our immune system protects us pretty well from it, so the effects are generally pretty mild. We always get over it in a day or two. Almost everybody in the world gets sick once or twice because these things go around, and like I say, because they're not very serious, we don't take them seriously. So people might have a cold, but yet they go to work and they cough and sneeze over everybody. They get the cold, they go back home, cough and sneeze, and so it spreads. I mean, the point is, since people don't feel it's important, they don't feel even necessarily that bad because they're taking pills, right? Normally they'd have a fever, maybe they'd stay home in bed, but hey, they take a Tylenol, I feel good now, I'm going to go out and walk and cough and sneeze over everybody. So in fact, these pills actually help spread the disease. But like I say, in these cases, the disease is not very strong. The flu, now this can be more serious. The flu is more recent in origin. The most dramatic example of the flu was an epidemic right after World War I that killed over 40 million people. And that was for a couple of reasons. It was new. Our people's immune systems were not adapted to it. Also, it spread very quickly because it was in 1919. After the war, there was a lot of poverty. There was a lot of people hungry. So that means their immune systems were also reduced. Also, people were being demobilized, right? Troops were being sent back from Europe to the U.S. or to Australia or wherever else. So people were moving in massive numbers around the world that didn't normally happen at that period. So that also meant the disease spread much more quickly than it normally would have. Right? Normally it would have taken much longer to spread around the world. And when a disease takes a while to spread, it tends to weaken over time because, as I said, people build up immune systems. And also diseases are pretty smart. Diseases don't want to kill people, they just want to live, right? They just want to live. So if they kill too many people, they're going to kill their own food source. So they'd rather not do that. I'm not saying that they think about it. I'm just saying that if you think logically, a disease that kills its host is going to die out, right? So if a disease is very aggressive, it will tend to kill too many people, and those aggressive diseases or viruses will die out and then be replaced by more milder versions, maybe. Anyway, so again, there's a virus. There's no cure for a virus. There's no cure for any virus except sometimes there are the antiviral drugs, but that might prevent them from reproducing in the body. Certainly antibiotics have no effects. There's no point taking penicillin or taking an injection of penicillin if you have a virus. It's a complete waste of time. It has zero effect on the virus whatsoever. There are vaccines though, so every year they come up with a vaccine, and basically they try to include all the known flus within that vaccine. But viruses, when they reproduce, they change, they can mutate very quickly. So as a result, the vaccine has to be done every year. You have to have a new vaccine every year because the previous vaccine might not have covered all the newer variants out there. Bacteriological infections. Now, bacteria like strep and gangrene and other things used to kill millions of people. Any small cut could become infected and potentially lead to death, right? So today, with the discovery of penicillin kills the bacteria, or many types of bacteria. So what that does is it cures you. Literally, it kills the bacteria inside the body, right? So this is a miracle drug. It's literally saved millions and millions of people. But it shouldn't be overused. You shouldn't be using bacteria or penicillin arbitrarily or whenever you feel like it or every time you feel a cough, because like I said, most of those are caused by viruses, not bacteria. You should only use the bacteria when it's recommended by a doctor, because this is the thing. The more we use antibacterials, then bacteria can also adapt to become resistant, right? And if they become resistant, then we won't have any other protection from them. Now, COVID-19 is a virus, and right now there's no cure. So far, I'm not going to look it up right now, but so far it's killed more than 500,000 people around the world, right? This may not seem like a lot. You say, well, the flu kills 500,000 every year. Why is this any different? Well, first of all, COVID-19 is new. It hasn't spread as much as the flu. Everybody gets the flu at least once a year, so it's killing 500,000 out of the entire world's population. COVID-19 has already killed 500,000 people to only about 10% of the population. So, and that's with protections. That's with a very, very strong and powerful social reaction, which we'll talk about in a bit, right? In other words, we've been actively fighting COVID-19. We don't actively fight the flu except by giving a vaccine, right? So COVID-19 is quite problematic. So because the death rate is about 2 to 3% of all infected people, right? Now there's a lot of debate about that number. I'm not going to get into the different issues involved, but in terms of declared infections, there may be, of course, people who are infected we don't know about, but that's true with any other disease. So if you're comparing between diseases, 3% is a lot, right? And not only those 3%, but many more than that may be incapacitated. Their lungs may never be recovered, right? So just because the other 97% are still alive doesn't mean there's not other expenses, right? And if nothing were done, the projections would be that it would kill about 40 million people, right? So we've been fighting it. We've kept the number of deaths down to about 500,000 so far. So that's a very good job, right? Again, there's no cure or vaccine for COVID-19. So the only option is prevention, right? So we're going to talk more about prevention in the next section. But the point about prevention is you have to prevent the transmission of the disease. We'll talk about that in a second. Right? Now, risk assessment. Why are we so concerned about COVID-19? Well, risk means you have to look at different factors. Right? One factor is likelihood. Another factor is severity. So this is the type of analysis we can do in occupational health and safety all the time. right? So, for example, if you're climbing up a ladder that's 20 feet high, right? So you'd say, what is the likelihood I'm going to fall off the ladder, right? So you look at the factors. If the ladder's in good shape, less likely. If there's no wind, less likely. If I'm experienced and careful, less likely, right? On the other hand, if there's a high wind, more likely. If the ladder's in bad shape, more likely it will fall over. If I'm not experienced or I'm falling around, more likely I'm going to fall over. So likelihood is very much based on behavior, right? How we react to something, right? So it varies, right? You have to say, well, under these conditions, it's not likely. Under these conditions, it's highly likely, all right? Now, severity is the other side, which is, well, if I fall off, what's going to happen, right? So if I fall off 20 feet, I'm going to probably crack my head, right? At least I'll have a serious injury, right? So you said, okay, what's the likelihood? Let's say I'm very careful, I have a great ladder, conditions are optimum. The likelihood of falling off the ladder is 1 in a million. If I fall off, I'm going to crack my head, so that's pretty bad, right? So 1 in a million chance of a very bad accident. On the other hand, if it's windy and I'm careless and the ladder's in bad shape, maybe the chance of falling off is 1 in 100, right? So now I have a 1 in 100 chance of cracking my head, right? So that's a very different risk, right? 1 in a million versus 1 in 100, right? So that's what we have to take into account, right? Now, when we're talking about a disease, the severity is going to be what can happen to me, right? Will I die? Will I be incapacitated? Will I have to stay home or go to the hospital? Right? So those are you could say the worst case scenario, right? The likelihood is going to be given by the transmission rate of the disease, all right? So let's see here, right? We have transmission rate, that is the rate at which the disease is spread from one person to another. Then we have the rate, in this case, we're using the death rate, right? So if it's 3%, that means if you get the disease, right, what's the likelihood you're going to get the disease in the first place? And secondly, what is the likelihood you're going to die, right? So that is going to add up to create risk, right? Which is what's going to keep you up awake at night worrying. Right? So what do we know? Right? Sometimes we don't know all these factors, right? Or we have to guess, right? But let's assume, for example, that you live in a community and as far as you know, nobody has COVID-19 in that community, right? So the transmission rate is going to be very low, right? The likelihood that you're going to actually get the disease will be very low, right? On the other hand, if you do get the disease, you have a death rate of 3%. So you have 1 in a million chance of getting the disease times 0.03% chance of dying. So that's, very, very, very small, right? On the other hand, let's say you go to a place where there's a lot of people and some of them are going to have, some of them will have COVID-19 and they're all talking and exchanging and there's no controls. Right? Now, under these circumstances, you have a very high possibility of getting the disease, right? Maybe 1 in 100, maybe 1 in 10 even, right? We know that there were rates of infection where people went to church, for example, right? And maybe 1,000 people went to a church and maybe some of those were infected with COVID and they spread the disease within that church, right? Or gathering, right? So then those people there, then 3% of them are going to die. Well, now what is the risk? You got 1 in 100 times 0.03, so that's 3 out of 1,000, right? So now your risk rate is much higher, right? And of course, it's going to depend on your behavior. How often do you go out? How often do you go to these gatherings? How often do you talk to people without any kind of protection, right? So you have to think in terms of the different levels of risk, right? So some risks, let's look in general, for example, right? So this risk matrix, we look in general at 3 diseases: the common cold, flu, and coronavirus, right? So here we're talking about transmission rate under normal circumstances where you assume one person is sick, how likely he is to pass that disease on to somebody who is not sick, right? Now, both the common cold and the flu have relatively, we could say, medium transmission rates, right? When you look at the transmission rate, you have low, medium, and high, right? So let's say they're both in the medium phase, all right? But coronavirus has a relatively high rate of transmission, right? So that means you're more likely to catch it from somebody else. Okay? The other side of it is the severity. So, for example, if you get the common cold, the worst thing that's going to happen to you is going to be, most likely you have to take a few days off work, right? And you suffer, pains and whatever, right? So that's not considered too bad. So when you combine those two together, you have what we consider a safe condition. Now, I'm not necessarily saying it's 100% safe. It's up to you. Personally, if I have a cold, I'll stay home. If I see somebody coming at me coughing and sneezing, I'll avoid them. I don't care if it's the cold or COVID-19. I don't want to catch it, right? But I don't have to necessarily take dramatic actions, right? Now, the flu transmission rate is about the same as the cold, but the effect of the flu sometimes can be more severe. So you sometimes might end up in the hospital, right? Anyway, it's a bit more severe than the common cold, right? But when you get to coronavirus, now you're looking at something where a significant number of people are going to die, right? And many more people will be hospitalized. So about 10 to 15% of the people affected will be hospitalized, right? So now we're saying this is what we call a red condition. You have a high severity and a high transmission rate, right? So when you have that, it's like going up a ladder in unsafe conditions, right? So now we have a 1 in 100 chance of falling off, and if we fall off, we're going to hurt our noggin or die. So do we do it? No, we don't. We wait until there are better conditions, right? We wait until we have a better ladder. We wait until the weather calms down, or we wait until we have somebody who has some experience climbing a ladder, right? So this is why many countries stopped work or took very dramatic steps to try to prevent the transmission of coronavirus by shutting airports, shutting communication, stopping people even from going to work or visit their families. So it was very dramatic, and of course a lot of people complained, right? They're like, oh, the government's telling us what to do. I hate the government. I don't want to wear a mask, right? Okay, but it's like at work. If you're going to be doing something that may endanger other people, you don't have the right to do that, right? And unless we control coronavirus, a lot of people will die. Now, it's a debate, let's say. But the point is, government authorities took the decision to shut down, right? Until we could come up with a better solution. Also, think about risk. Not everybody is equally at risk, right? Like I said before, if you're out mingling with people all the time or in constant contact with the public, you're at much higher risk than somebody who stays home or works in the back office and doesn't really talk to anybody, right? So some risk professions are high risk because, for example, medical professions, you're dealing with sick people. So you're going to be the first person to get infected. People in a high public contact position, like police officers, receptionists, shopkeepers, restaurant workers, ticket collectors, bouncers at clubs, right? All of these people deal with a whole range of people every day, sometimes in very close proximity, right? So again, some of those people coming in, if you deal with 2 people a day, okay, they're probably fine. But if you're dealing with 10,000 people a day, some of those people might have the disease. So, people who attend a lot of movies, social events, if you're going out all the time, right? This is why politicians and celebrities have a much higher rate of infection than people in other professions, right? Now, other people are at more risk because the severity is higher. So, for example, older people and people with underlying health conditions such as heart disease or diabetes, for them, this disease is much more dangerous. They are much more susceptible to illnesses, and they are much more likely to die, right? So we have to look at people who are at higher risk because of the higher level possibility of transmission, so people with a lot of public contact, or we look at people remember, the other side of risk is severity, right? For some people, the disease will be more severe. So there's no cure. We cannot kill the disease, right? There's no vaccine. There's nothing to boost our immune system, right? So we cannot attack the disease directly. So what can we do? We can prevent the transmission of the disease. And that is the strategy we have taken. Now, there's nothing new in this. Preventing transmission has always been one of the core aspects of public health policy, right? Which is, unfortunately, we lose sight of public health policy because we're always focused on medicine. Medicine, we look at the doctor and they're all glamorous with their hairdos and stuff. It's all very good, but medicine focuses on the disease itself and trying to cure or kill the disease, put it that way, right? Or cure the patient at least, not the disease. Kill the disease, cure the patient, right? But medicine actually has a very, very bad case record of this. Medicine very rarely cures any disease, but they can sometimes keep you alive long enough so your body can cure itself. So I'm not going to bash doctors. They've got their role. They do a great job. But the reality is prevention is actually where it's at in terms of most diseases. And again, this goes back to occupational health and safety. Occupational health and safety is not about curing a disease or solving an accident. It's about preventing an accident. It's about preventing the disease, right? So we're all about prevention in occupational health and safety, right? And this is why it feels like sociology and anthropology are very appropriate, because we're looking at human behavior and how to get humans to behave differently, right? So what we've done so far, at least on the government level, is they shut down many countries, they prevented airports, they prevented people from going to work, right? But as you see, right, if people don't go to work, they don't earn any money. There's nobody producing anything. We need food. We need this. We need that. We're a productive society, right? We can't do that forever, right? So eventually people have to go back to work, right, as they have done. And this is the problem. People go back to work, and then they start spreading the disease again, right? So we need to have a way of working that doesn't involve spreading the disease, or at least that reduces the spread as much as possible, right? So we cannot eliminate it, but we can reduce the likelihood of transmission, right? If ever there's a cure, it will take years to develop it, a vaccine or something like that. But we can reduce transmission. And basically 3 very simple principles, right? One is hygiene, right? So keeping clean, washing your hands. We'll talk about this, right? And in fact, hygiene has saved more lives in the last 100 or so years than all the advances of medicine put together, right? Because hygiene is what has saved us from many, many viruses and bacteria, right? Isolation. Isolation simply means staying away from other people. Isolation doesn't have to be complete. Of course, there are relative levels of isolation. And PPE. So we're going to have to start using PPE, like gloves, like masks, other things. So normally, if you asked me a year ago, I would have said the goal of occupational health and safety is to make the workplace so safe that we don't need PPE. But now we're going to need it, because now we have a disease and we're going to have to start seeing people in office environments or normal everyday environments with masks on, with gloves on, right? With maybe even spit guards on, right? As if they were doctors, right? Because this is where we're at, right? This is the level of danger we're facing. Hand hygiene. Now this is probably one of the best things you can do to protect yourself from any infectious disease, because of the amount of times the hand is used to take things to the mouth. And of course, for gastrointestinal problems, of course, very, very important to wash your hands before you eat anything, right? But even everyday respiratory diseases, for example, as we talked about earlier, you shake hands with people, they may have viruses or bacteria on their hands that then you're going to carry to your throat, right, when you touch your mouth, because we do touch our mouths quite often, right? So whenever you're in public and you're touching things or you're shaking hands with people, which, by the way, you should probably not do, but if you do, wash your hands. Now, how do you wash your hands? What does that mean? You don't put it under a couple drops of water for 5 seconds. No. You have to have at least 20 seconds where the entire hand is immersed in soapy water. Why 20 seconds? Because that's about the amount of time it takes to kill the viruses, right? Viruses, as I said, they're just a protein packet surrounded by oil. So the lye in the soap is going to break down that oil and basically dissolve the viruses. It also does a number on the bacteria. It will kill most of the bacteria. 99.9% of the bacteria will be killed by a soap solution rubbed in your hands for about 20 seconds. So first, of course, rinse your hands with clean water. Then get the soap lathered all over your hands, and then start counting 20 seconds. Right, so 1, 1,000, 2, 1,000, 3, 1,000, 4, 5, 1,000, 6, 1,000, 7, 1,000 more, 8, 1,000, 9, 1,000, 10, 1,000, 11, 1,000, 12, 1,000, 13,000, 14,000, 15,000, 16,000, 17,000, 18,000, 19,000, 20. Whoo! There you go. Right? So, not that big a deal. Right? The problem is when we're washing our hands, we're always in a rush thinking about what we're supposed to do next. Well, don't think about washing your hands, right? It's very important. Right? Doesn't mean you have to wash your hands every 5 minutes either, just after you've been in public contact with other people, right? Rinse your hands properly and thoroughly. You don't want to keep any soap on it. And then you want to make sure you dry your hands. Now, dry it, don't use the ideal thing is to use a paper towel that you then throw away. Don't use if you're in a public facility, for God's sake, never use any shared communal towel, things like that. That used to be ubiquitous in bathrooms around the world. I think they got rid of those after the 1970s, 1980s, thank God. I remember seeing those things as a child. You'd have these towels and you just dry your hand and the germs of a million people are on those towels. So forget that. Use a clean paper towel. Air dryers, I don't recommend air dryers because if there's viruses or bacteria, maybe they get stuck in the machine, they get blown out again every time you turn it on. So I'm not a big fan of that. I prefer paper towels. Right? And then use the same paper towel to open up the doors and turn off faucets or whatever you need to do. so you don't have to touch a dirty surface on your way out and get your hands contaminated again. Keep in mind, now your hands are clean, you want to keep them clean. Don't be touching things randomly or shaking hands with people right afterwards. Housekeeping. So you want to make sure your housekeeping staff realize they have a very important job. They need to sanitize the building. Now, you know, you're not going to have a 100% sanitary facility, but basic rules you should be following. So look at high traffic areas where a lot of people go, things that are going to be touched often. So, for example, counters in public areas, bell buttons, elevator buttons, surfaces where people might lean up against or things like that. Look in waiting rooms, break rooms, lunch areas, high traffic corridors, doorways, handles, counters, elevator controls, switches, keypads, cell phones, etc. Also think of shared equipment like computers and things like that. So these need to be sanitized. Now what does that mean? That means you need to be able to spray them down with a 70% alcohol solution is the best thing. There are other things on the marketplace. So just make sure that whatever you're doing kills viruses and bacteria. Right? The workers should be supplied with gloves, and they should either dispose of those gloves after their shift or they finish working, or sanitize them if they're reusable gloves. Remember, the germs will hide in dirt, so if something's dirty, you need to clean it first and then sanitize it. Right? Think of rules for sanitation. Whenever you have different people who are using the same area, one of them may be sick. Now, if everybody in your facility is screened on a regular basis, maybe you don't need to worry about it so much, right? But if you have members of the public coming and going, and they're not adequately screened, well, then you need to sanitize on a more regular basis, right? So public facilities like supermarkets and stores should be screening people. They should make sure people who are coming in do not show symptoms. Ideally, they should ask people to wear a mask, right? That's a minimum, and also gloves, because the gloves may not be so much for the customers, but for the store. If everybody's wearing a glove, at least they're not transmitting the disease germs around the store, right? Again, keep in mind you need to clean and sanitize surfaces where people are going to be touching, right? So that's going to be, step up. So you're going to need to step up your sanitation and cleaning regimens. Maybe hire some more cleaning staff. In a restaurant, you also need to think about sanitizing or making sure food is kept sanitary. So all the kitchen staff, the waiter staff should always wear masks at all times, especially when they're handling food, and they should wear disposable gloves that should be removed after they have dealt with each customer. They shouldn't be using the same gloves for everybody, because they're going to pick up the germs from one customer and give it to another, right? So make sure if you're in a restaurant, you insist that they use new gloves when they serve you, right? And that they have their mask on at all times, right? Remember, restaurants and things like that, any public area is going to be a hub for the spread and transmission of diseases like this. For disinfection, the EPA, Environmental Protection Agency, has approved disinfectants that are very effective against viruses as well as bacteria. So try to look for those. EPA means they've been approved. They do not damage the environment. If you cannot find those, alcohol solution of at least 70%. That means alcohol or bleach solution, I should say. A bleach solution would be 5 tablespoons of bleach for every 1 liter of water, right? You then put this, so there's not that much bleach, right? But so basically you have a half-liter size spray bottle. You put 2.5 tablespoons of bleach in it, then you fill it up with water, and you can spray that on surfaces and let it sit for a bit and then wipe it off, right? Now, of course, if you're using this, make a new batch regularly, because bleach, of course, loses its effectiveness over time. Right? Don't mix different disinfecting products like bleach and vinegar or other combinations may in fact be explosive or corrosive. Right? And if you are using high alcohol content or high bleach content or other types of chemical compounds, always make sure the area is very well ventilated while you're disinfecting. Right? Besides whether or not workers are wearing masks, they need to breathe oxygen. So you need to have lots of air going through. If it's an enclosed area, you need to provide them with a fan pushing or pulling air in or out of the area. Changes in workplace routine. So things that you should consider and implement if necessary. Right? So screen all workers and visitors. If you have a lot of workers in a big building, you should screen them every morning when they come in. All the workers should be screened. Right? Visitors should also be screened. Right? So that anybody coming into your space, you can have some assurance perhaps they at least are not symptomatic. Of course, no screening process is perfect, but a minimum, see if they have a temperature or a fever, if they're visibly coughing or something of that nature. Require use of sanitation or wash stations at all entrances. So all entrances should have a sanitation. So maybe alcohol sanitizer. In that case, you want a 60% solution that people are going to use on their hands. They rub it all over their hands. Or have a wash station with soap and water that people could wash their hands, again, for at least 20 seconds. Right? Guards, remember, guards are in very high, in high traffic areas, have a high potential for transmission or getting the disease. So they need social distance barriers, right? Literally, anybody in a public service position, like a receptionist or a bank teller or a clerk in a supermarket, or anybody else where they're dealing with a long succession of people randomly, members of the public, they should be behind glass or plastic, right? And this is very cheap. You can just have very cheap plastic, or you can have cardboard walls put up between customers and the receptionists or customers and the guards. And if a guard has to step out in order to frisk or check somebody, they should have then a very good mask, not the crappy masks they're being given most of the time. Right? Food service precautions. I could go on for this forever. I'm just going to note this. If you're providing food in your workplace, you need to be very careful that food is dealt with properly. Right? And that includes things that should be normal, but unfortunately not. So all staff, kitchen staff, must always wear a proper mask, right? And they should wear gloves. So those gloves should be changed at regular intervals, right? You shouldn't be going into a place and seeing somebody with a glove on, they're sucking on their gloves, or they're scratching their head with their gloves, getting germs on the gloves, and then they're touching your food with their gloves. What's the point of the glove? You might as well have them lick the food, right? So get serious, right? You should not allow food service staff at any time to be contaminating the food, right? Now, the other thing is get rid of cold food. Don't serve things like salads and things of that nature unless they have been prepared in extremely sanitary conditions and then packaged so that they didn't get dirty afterwards, right? So you can make salads and then put them into individual bags that people can then use. But if you just have salad in a tray and people are coming on sneezing on them and things like that, I avoid the salad, right? So, of course, sneeze guards should be standard if you have a buffet or anything like that, or a serving area where people are watching the food. But an open buffet where people serve their own food, that should be abolished because people are coming in and breathing on the food or touching the food with their fingers and things like that nature. So again, food service staff should be highly trained food preparation and service staff highly trained in use of PPE to protect their customers, right? And if you go to any restaurant, you should follow the same precautions, or make sure the restaurant is following the same precautions, right? Now, if you're receiving food hot at the table, it's not that big a deal, right? No bacteria or virus is going to live in any food over 60 degrees centigrade, right? So if you're just eating hot soups, hot foods, then, I'm not saying throw precautions to the wind, but you can be much more comfortable and not worry as much about these types of things. Other changes: provide masks and gloves for all staff. Every staff member should at least have masks and gloves available to them. The ones who must use them all the time, of course, would be people in a security or a public contact position. Security guards, police officers, receptionists, anybody who's dealing with the public. These people need to have the best PPE in terms of masks and gloves and so on. Social distancing. Separate workstations by about 2 meters. Now, there's a lot of debate. Is 1 meter enough? Is 1.5 enough? Is 2 meters too much? Well, look, restaurants and bars want to make money, so they want to lower the barrier to 1 meter. They don't care if you all die as long as they make money first, right? Frankly, 1 meter is not going to stop you from spreading a disease to somebody else, especially if you're coughing and sneezing, right? If somebody sneezes, they will spit out that germ, billions of germs, at about 200 miles per hour, and they will reach at least 6 to 8 meters away, right? So don't be fooled by these people saying 1 meter is enough distance. Now, I'm not saying you have to keep your family members away. Look, if you live with people, you're around people all the time, then, whatever. You're gonna, if they get COVID, you're gonna get COVID, right? So, but if you're dealing with strangers, I still apply the 2 meter rule, right? In a workplace where everybody's screened, okay, maybe we can be a bit more flexible with that, right? But workstations should be regularly separated out, right? As much as possible, put barriers between them. And again, particularly if you have public coming in, you should restrict the public to certain areas which can then be monitored and cleaned and disinfected on a more regular basis. Again, use virtual meetings. Well, why not? We have the internet, we have Zoom, we have Skype, we have all these virtual platforms. Why do you need to walk down the corridor to talk to somebody? You can Skype them, right? Or just call them on the phone, right? You want to see their face, Skype them. Okay. You don't need to necessarily have a face-to-face meeting. Meetings where everybody has to gather in one place. Again, why? Right? So we can do all of those on Zoom or on other types of technologies, right? So you should, right? There's no reason, if you don't have to go out, don't go out, right? Other changes. Expand work at home options. So obviously every company should look more and more at, can tasks be done at home? If they can, why do we need the guy to have to come into the office where they're going to be exposed, right? So do that. Institute zero symptom workplaces. That means, as opposed to the past where employers would be like, oh, you're sick? Well, I need a doctor's note, and I need a medical certificate, and I need this, and I need that. In other words, they made it very hard for you to stay home when you were sick. You have to have the opposite policy. You want to encourage people to stay home if they feel sick, right? They can work from home, right? As long as they can work from home, they don't even need to use a sick day, right? So you need to have a very liberal sick policy and a liberal work at home policy, right? Of course, that means you need to change your structure in terms of supervising people, and obviously we want to make sure people are still working, right? They're not just collecting a paycheck, right? Very, very important. Incorporate age and health of workers into every risk assessment, right? Now, in theory, we always should be doing that, but we often forget, right? So if somebody's old and they're in a let's say somebody's 60, he's nearing retirement, and he's a guard at the front door, right, checking people for sickness. Is that a good position for him? No, because he's very likely to have a severe reaction if he gets the disease. So you need to put young people in those positions, right? Because even if you give them masks and everything like that, if they get the disease, for the older person, will be much more severe, right? So any people in those higher risk categories, we need to move into low public contact positions, right? So as the severity goes up, we need to reduce the transmission, right? Severity goes down for young people. Okay, those people we can, I'm not going to throw them to the wolves, but we can put them in a bit more risky transmission features, jobs. Use of PPE, like I said before, our theory was always we don't want to use PPE. We want to solve all problems before we have to use PPE. And I always use the example when I was teaching a class. You say, well, in a construction site, you can't get rid of all the hazards, so you have to use PPE. But wouldn't it be terrible if you went to an office and people have to use PPE? Okay? Well, now we're going to have to, because we've got this invisible disease that could kill people, right? So things like masks and gloves are going to be necessary, right? So anytime you're interacting with people who may be infected, right, then use a mask, right? Definitely use a mask, right? Do not fiddle with your mask. Do not play with your mask. The mask should fit solidly to the side of the face so that you do not have air gaps between the mask and your face, right? Now, these surgical masks people are using, no, these are not appropriate masks, because you'll notice the surgical mask billows out when you breathe out, right? That means that you're breathing out germs, right? Those germs are not being stopped by the mask. Think about it. The surgical mask was developed to stop doctors from spitting literally into somebody's wound while they were operating. That's why it's called a surgical mask. It was used during surgery, and it was to stop the surgeon from spitting into the open wound, right? And therefore contaminating the patient with whatever bacteria they had in their mouth, right? It's a great thing, but it doesn't protect from viruses that are airborne, right? Now, it'll protect to some extent. I'm not saying it's completely useless. It'll give maybe 50%, 60% protection, but it's not the solution, right? The other thing is using gloves. Okay, fine, but then don't fiddle with your gloves. Change your gloves or take them off. Rather, change them. Discard them if they're disposable gloves. You should use a different glove for different patients. If you're a medical person, obviously the doctors know this already. They don't run around with the same gloves all day. They change their gloves, because that's the whole point, is not to transmit a disease from one patient to another, which is what doctors used to do all the time and kill everybody, right? So instead they should change their gloves. Also, but the same is true, like in a restaurant, if you're serving one customer and you bring them the food and you're picking up their dirty dishes with all their bacteria and viruses on it, right? You don't go out again with the same gloves and then serve somebody else. That would be disgusting, right? So it's better not even to use gloves and simply say, okay, wash your hands after you deal with every client, right? In a restaurant, literally either when they're done with the client, they bring back the dirty dishes, they should wash their hands for 20 seconds or change gloves, right? Every new customer deserves a new set of gloves, right? Sorry to say that, restaurant owners, right? So this is the type of respirator you should be using. It's called a NIOSH approved N95 respirator. N95 is not enough. It should say NIOSH approved. Unfortunately, it's very hard to get anywhere out of America. NIOSH is the National Institute of Occupational Safety and Health, and they specially approve these types of things in the United States. I'm sure there's similar brandings for European and other places, but unfortunately we get bombarded by all of these Chinese products, and they'll say K95 or this 95, whatever 95. Now the idea of 95 refers to this will block 95% of all molecules or whatever going through, right? It's not going to block everything, but it should block almost all of any water molecule or water droplet large enough to carry a virus like COVID-19, right? You don't necessarily need this little patch in the front, right? That's a filter system. The whole thing is the filter. The most important thing that it fits snugly around your mouth and nose, right? And this metal band should be adjusted so that it fits tightly around your nose, right? So otherwise, if you have a mask and you're breathing in and out and you notice you're breathing in and out around the mask, then it's not doing anything, right? So this is the kind of mask you want. You want to make sure that all the air is going through the filter. Now, there may be other conditions or other issues that come around. All right? You can always send me an email, ask me any questions. Don't ask me any medical questions about COVID-19. I'm not a doctor. I'm a sociologist. I'm an occupational health and safety specialist. Okay? So I deal with prevention, not cure. So I can't tell you, do you have COVID-19? I don't know. Do you have the right symptoms? I don't know. Look at the presentation. I just said there are lots of different symptoms. Only a doctor will know after he takes the test. So don't be asking me over the email about whether or not you have COVID-19 symptoms, right? Or what the cure is, or whether taking lemonade pills will help or whatever, right? But if you have questions about how to help prevent COVID-19 in the workplace or in your personal life, that is very appropriate. And of course, you can hire us to come in as expert consultants to your business, or to provide training for your staff. That's what we do. That's how we make a living. All right? So thank you very much. You have a great day, and I hope you enjoyed this presentation. If you do want a certificate for this course, you must take an exam. So you would have to sign up and take an exam. Now, these are offered occasionally. If you have a group of people, that's a lot easier, a lot better. Then we can run through the themes of the course very quickly online after you've viewed the video, and we can then give you an exam, which is not hard, but just make sure you've been paying attention. All right? So if you want to do that, make sure you contact us at the contact information given earlier. Okay? Thank you very much and have a great day. Bye. Bye.